Hey Kyle, thanks for joining me on Beyond Scrubs. Can you introduce yourself?
Yeah, sure. So my name's Schnell. I'm a second year medical student at Texas Tech, University Health Science Center.
Gotcha. Gotcha. So, can you talk to me on kind of why you chose to go to medical school?
So for me, it was I've just always been interested in just like the medical field, biology more specifically. It's always been my favorite subject, high school, college, what have you. A bit of an interesting background. I was an athlete. I played baseball and I swam in college. For me, I one of the things I always wanted to love to do too is be a coach. And one of the things I found that really helped me really lock into medicine was being a doctor is like being a coach for health. And so for me, that was I guess you could say my realization, what have you. But just bridging the two things together.
Yeah, for sure. Definitely interesting. Being an athlete in college and then transitioning to medical school, definitely a very, very unique route. Do you feel as though this route, being kind of a athlete in college, doing more than one sport, do you feel as though this benefited you kind of in medical school?
Oh, for sure. I mean, it gave me such good just how to manage my time and just having a good work ethic, especially in medicine. And just I think one of the things that has helped me the most is just knowing how long things will take me to do. Because when I played sports, I mean, you had like 5 6 hours a day that you were going to be playing sports. Then you had to be able to determine what you needed to focus on and how much time you needed to focus on each individual class while you were in college. And what made medicine really nice to me is, I mean, while it's difficult, I mean, there's a lot to know, there's a lot to learn. It's only one class, really, at the end of the day. So for me, it made it a lot easier looking at it that way. And especially as we just go through each individual subject or what have you. That was what helped me, I guess, the most, if anything
Sure.
else with that.
Yeah, for sure, for sure. What do you feel like was a harder sport if you were to say? Was it swimming or was it baseball?
Oh, goodness. I'd probably say swimming. Just because the amount of work you have to put in and the time commitment and how the results are very especially when it comes to swimming, like you fight for like tenths and hundredths of a second each time you swim in a race, and you put in all this time, all this effort, and if you drop half a second off your time, you're completely excited, like it's you did a great job. And that's kind of a hard thing to see, or at least for some people especially. It's just I've been a swim coach, what have you, and everybody wants to see seconds, like multiple seconds, drop off their time each time they swim. And especially when you get to the higher levels, that's not what it is at all. It's. I mean, you can in longer races drop multiple seconds, like say like if you're doing a long course, like a 400 meter or an 800 meter freestyle. But when it comes to like the 50s and the hundreds, you're lucky if you get half a second. And that's just a good day.
Yeah. Yeah, for sure. Definitely sounds super tough to kind of train all that for, like you said, tenths of a seconds, right? Do you feel as though the margins on an educational standpoint when you get to medical school is pretty close like that too?
Oh, sure. I mean, especially with the change to pass fail these days, especially just well, tech is on a pass fail system, and I know some other schools are going that way, but STEP especially is on a pass fail now. And that it kind of changes the way everybody wants to look at it, but at the same time, if you try to treat it as a pass fail exam, you're going to probably fail. It's a
Yeah,
really tough test, and if you don't put the time in and you don't work for it, you're going to fail. It's
for
just it's how the test is designed. You really have to, regardless of it is, you have to put the time in, you got to put the work in, you still have to study for it, and you still want to do your best regardless. Because I mean, especially in medicine, it's so cutthroat and how things can be. You gotta at the end of the day, you always want to be at your best, and especially when it comes to taking a step or what have you. So
yeah,
you
yeah,
got to
for
put the
sure.
time in.
Yeah, yeah, for sure. The margins, like you said, if you're not really aiming to be on your best, right? And these tests
Mhm.
are not a walk in the park. So if you're not aiming to be your best, then, I see, a lot of medical students barely fall short because they were aiming for the pass, right? And so,
Yeah.
yeah, for sure. Definitely the margins are a lot closer than people think, even though it's a pass or a fail. But if you're not at your best, you can still definitely fail, especially step one. So,
Hmm.
yeah, so kind of doing a little transition here. I know, you going to medical school is a little bit unique in another sense is that you chose the FMAT program.
I
So
did.
talk to me a little bit about that.
Sure. So the FMAT program here at Texas Tech. So it's a 3 year route, and you get basically a guaranteed residency right in family medicine, and basically they condense it such that you have a 10 week. Um, I guess you do your first rotation in family medicine concurrent with your second year of medical school. So you basically start doing your clinical rotations and basically seeing patients during your second year, and usually that's 1 or 2 days out of the week that we're in clinic, say from 8 to 12 is usually what we do every time. And you got that on top of also learning everything you got to learn from medical school and doing your tests. So you have to really you have to be able to balance it really well. For me personally, I love it. They like to take really good care of us and make sure that we got all of our needs addressed, what have you. We get like a free iPad and all kinds of other things. Like they want to make sure that they take it's like one of their favorite programs. It's like their pride and joy of Texas Tech is their FMAT program, and I've loved it so far. It's been so much fun, especially applying some of the things we've been learning in medical school to actual patient encounters and getting to see patients, especially during second year. And one of the bigger things you learn to do too is how to present patients and what doctors are looking for, especially the attendings. Obviously, that changes with each rotation you're in with surgery or what have you, or a specialist. But with family medicine, of course, you're going to give a more like a broad-based sort of thing. And you really, one of the biggest allures for me, I guess you say family medicine, I like to talk to people, I like to get to know people. And that's something you really do in family medicine. Like specialists, you definitely can get to know some people. You get your frequent flyers, or the people that come to see you often because they have the same condition, and you get to know them. But when it comes to a lot of people, it's kind of you see them once, and that's the only time you ever see them. Whereas family medicine, you're with them. People like to joke, especially if you give birth, what have you, womb to tomb is the thing that goes around family medicine, because you're just with them from when they're born to when they die. Yeah.
Yeah. Yeah, awesome, awesome. How did you kind of get interested kind of with the FMAT program, I would say, right? Since that is an early decision in your career, and obviously kind of talking to you, I can see you're passionate
Uh-huh.
about it for sure, but how'd you find out so early that you're passionate about family medicine?
So that's a good question. So for me, with my sports background, I always knew I wanted to do something in sports. I always thought ortho was going to be the route I wanted to take. Early on, that's what I thought as well. I actually happened to join FMAT my second semester, which is something they let you do your first year of medical school. Like some people come in and they're already FMAT from the start, and but there's the people that like me who kind of find out later on that they want to go maybe a family medicine route. For me, sports medicine is what I want to do. Family medicine to sports medicine fellowship is my goal, or my plan right now is to go through residency and come back and do the fellowship here at Texas Tech. So for me, it just made a lot of sense to go that route, especially since the doctor I want to be, when it comes to ortho, especially with athletes, you see them when they're broken, when they've done something, they've hurt themselves. You fix them, you send them back onto the field. Whereas sports medicine is more so you're there to make sure they're staying healthy, they're taking care of themselves, they're not putting themselves in a situation where they got to go see ortho. And for me, that's more like the doctor coach. That was what I always saw myself would fit best for me and what I wanted to be. So when I made that realization, for me, FMAT was just an easy decision. It's just such a good program that they have at Tech, and the way that they've gone about it. And they've been doing it for such a long time at this point. Like we're like we're like the 11th class now or something wild like that. But yeah, and we've been our mentor, who's Dr. Hobart. She was the first class of FMAT, and she's been guiding us through the whole path and everything. She's amazing at what she does, and she's such a good doctor. And it's been a lot of fun learning from her. But main thing, long story short, sports med for me made the most sense, and FMAT was a great path into sports med.
Yeah, that definitely awesome path to kind of bridge your athletic background, wanting to coach, and of course, going from family med to sports med. I would say that path is probably not as apparent to most people. Like you said, most of my friends that are in sports when they started med school, which actually, ironically, there's a lot of people in medical school that played sports, right?
Mm-hmm.
Whether it's for college or whether it's for the club's team in college, right?
Mm-hmm.
But yeah, everyone thought ortho first, right? And so
Yeah.
definitely for sure, there's different routes to be around sports, especially if you're passionate about it. And like you said, definitely kind of that preventative side, working with them kind of to stay healthy, right? And I think that's a very unique perspective, of course. But that's awesome. So kind of throwing you a little curveball here. What is your perspective on kind of the shortages of physicians across the U.S., right? So, the American Medical Association estimates that there'd be like 37,000 to 100,000 physicians short over the next
Mhm.
decade in the U.S. So, what's your perspective on that?
Oh, well, I mean, uh, that's a good question. The way I think about that is, yeah, it has to do with how the number of programs made available, what have you, and also people. A lot of people want to. I know one of the biggest things that went unfilled, at least this past round, was EM. It was
Yeah.
largely unfilled. Like, I mean, if you just applied, you got in essentially. Because it was like I don't know the exact number, but I know it was something like over 30%, something like that didn't get filled, and
Yeah.
it's difficult when you have things like that because a lot of people. It's not that EM. Obviously, we need EM. EM is so hugely important, but it just doesn't always necessarily draw. A certain amount of people want EM, and that's what fits best for them, and it is the best for them. But not everybody necessarily wants that. And I think one of the biggest things that, I can think of is the shortage, especially, is how many like specialist spots are open. Like I know at Tech, for instance, we have one EM slot per year, and you have everybody essentially fighting for one spot who wants ENT or what I said EM, I meant ENT. And one of my friends was on here earlier, Zach Salter. He wants to do ENT, and it's tough, especially like hearing all the different things he's doing to work towards that. But I would say in terms of just the physician shortage in general, it's also we have very small class sizes. We sit at about we actually have one of the bigger ones at 180. A lot of
Yeah.
schools sit at like TCU, for instance, sits at 60. Uh,
Yeah.
Small classes and also fighting for very limited numbers of spots for what there is, and that leads to it, especially as more and more doctors retire, and it's just making sure that their ranks get filled as they come up. Yeah, it's certainly a problem for the future, near future as well, especially as we're getting like a boomer population, a very aging population getting to that spot, and we don't necessarily have all the positions on hand ready for that. That's just it's a complex question that, yeah, we're something we're gonna find out pretty soon. I would say within the next 10 years for sure. I mean, it means we're gonna be either really 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 busy or we're gonna have to get some more doctors on hand. That's for sure.
Yeah, for sure, for sure. And the reason why I ask you that question, I know it's a little bit of curveball, and like you said, it's super complex, right? I mean, it deals with the whole system issue, right? Like,
Hmm.
how many medical schools there are, how many medical students are allowed, and then the bottleneck gets even worse, right? Like how many residents they even match, right? I mean,
Hmm.
it's a whole systemic issue, but I think one of the main specialties, right, are primary care physicians, right?
Yeah,
And we always talk about, everyone always talks about, the subspecialists, right? But really, in totality, right, where it's taxed the most is our primary care physicians, right? And
yeah,
family med is one of the huge ones that we definitely need because, not many people are needing ENTs on a day to day basis, right? But
exactly,
any kind of illness, they're coming to you, right? So,
exactly.
how do you feel as though we can, create more family docs?
I mean, programs like FMAT are amazing. Getting certified is there's becoming more and more. Getting certified obviously is a tough thing because med school normally 4 year route, and then getting an accredited program for the 3 year route like the FMAT. I know there's like 12 or something like that across country. I know Penn State has a very good school as well that deals family medicine, just like Texas Tech here. Um, Obviously, I think programs like that would be great, especially on the 3 year route, being able to get more and more doctors, I guess, to the finish line, if you will, quicker. But and also just creating good docs, because I think one of the greatest strengths of the program, obviously, the second year, being able to see patients and being able to interact with them, understand basically what's expected of you is one of the big things, and also how to just better interact with people and treat them more effectively, especially in the family medicine department. I think they do a really, really, really great job here, and I've learned so much just in 1 year. It's crazy, but and I think when I come in the third year, it's just going to set me up so well. But I think, yeah, to answer the question, I think more programs like the FMAT ones here and larger ones, because our class is about 11 is this year, And in the past, the max for us is 20, and it'd be awesome if we can get 20, but we don't always get that number. I know the
Sure.
past year, I think they had 9, but the
Sure.
year before that they had 16, and then the one that's coming up, I think, is another big one. But yeah, certainly one of the biggest things would be, I think the FMAT program would certainly help, especially just giving people incentives to want to go into family medicine and seeing the benefits of doing it.
Yeah.
Yeah.
Yeah, no, for sure. Great answer. I mean, I think the FMAT program is super, super valuable, especially, 3-year program. Do you feel as though that helps prevent kind of that burnout? You feel as though the extra year off kind of,
Uh, I would say yes. I think one of the things that can really help prevent burnout too is just like with the program of FMAT is I know I'm passionate about it and I like it a lot, but it feels like it would draw people that are passionate and really want to do it. I think one of the greatest things that helps burnout is just like when you really have something that you really like to do, it no longer really becomes work. It's more like
yeah,
something you get to do, and it's that's one of the biggest things that can help with, I would say, things like burnout or what have you. And just kind of a side topic altogether, but just because of today's age and just how far we're coming along with technology, AI, what have you, a lot of the things that used to be like minutia for doctors, like note writing, just keeping up with doctors, is getting like semi taken care of with like AI, what have you, or like online scribes. Like there's a program we use called DAX, and basically you have like an online scribe. They hear, so you record your encounter with the patient, and the scribe, what have you, just takes down the vital information, creates your notes, auto populates it. So as a physician, you can quickly go through your note just to see what it looks like when they churn it out. But for the most part, all you need to really focus on is the assessment and plan, which is all you really wanted to worry about for the patient, rather than getting bogged down in a long HPI or what have you, and you have someone on the other end to help you out there. And that's one of the bigger things to help out with burnout, notes especially, and then just like the constant every day with all the patients. But I think one of
yeah,
the bigger things is, as AI comes forward and does more and more for the profession, I think it's going to help quite a bit.
yeah, for sure. And I think in the medical field, especially, right, AI is starting to kind of, of course, this is a little bit a different topic, of course, and we could
It
talk
is.
hours, of course, but definitely
Mhm.
as AI kind of evolves, right, not only kind of on the EMR standpoint, but on medical education, kind of what we're doing with our business, as you already know, Kyle, is for
Yeah.
MD Boost is kind of allowing that to kind of speed up the process of learning medicine, right? And of course, taking care of some of the things that are a little bit nuanced that might not be as important to help kind of filter out, not only on an educational standpoint, but like you said, in
Mhm.
EMR, right? Is, speeding up the process of,
Yeah.
like you said, the note taking or, the paperwork and things like that, so that you have more time to see more patients, right?
Yeah.
And
Just
in a sense, be
increasing
more efficient.
efficiency. Yeah.
Exactly. Bingo.
Exactly.
Exactly. So definitely for sure, which is why, as you already know, right, why I created MD Boost is to try to make
Mhm.
medical education a little bit more efficient, right? And, then when you're more efficient, you feel like you're moving, you feel less bogged down by these kind of nuances, and it becomes more enjoyable as a whole process of learning. So definitely for sure,
Cool.
great kind of, a little segue there
Mhm.
about medicine for sure, because we are trying to integrate ourselves a little bit more with
Yeah.
technology. But as you already know, medicine is kind of always lagging behind technology a little bit. Medicine is old
Yeah.
school when it comes to that standpoint, right?
That's for sure.
Yeah, yeah.
And it
We're
makes sense.
always kind of just,
Yeah.
yep, stuck kind of in the past a little bit. So,
Yeah. I mean, it makes sense. Like honestly, because most of the doctors are of an older age, where AI or anything like that really wasn't much of. Well, obviously wasn't really much thing at all. And then as younger doctors take over, we're more accustomed to it. We've grown up more with it, and so for us, it's just a much more tangible thing to take on. It's a lot less of a learning curve, should I say? And just yeah, and I think it's like we. I feel like we get this question every once in a while about AI or what have you. But my stance has always been, I think it's just gonna overall, it's gonna make medicine more efficient, and it's never gonna replace a doctor. This won't happen, but it will just make being a doctor easier or simpler, or you get to just, as you said, focus on the patient more and focus on seeing in and of itself more patients in a more timely manner and more efficient manner, and that's going to help so much. Like, this is just something I like a lot, and so for me, I think it's going to really help, especially with burnout, things like that. Just on a day to day, it's just going to take so much minutia out of it that you normally would have to do, but now it's just going to be more like taken care of in the background, if you will.
Yeah, 100%. And I'm a strong component of that too. I know there's a little bit of skepticism with AI, in which I think you should have skepticism, right?
For
Because
sure.
yeah, because if not, then I think that we wouldn't be very good physicians or medical providers if we
Exactly.
weren't skeptic, right? So,
Hmm.
but for sure, I think that as we kind of figure out where its place is and it's a little bit more defined, like you said,
Hmm.
I think it just makes us more efficient as
Yeah.
healthcare providers and allow us to really kind of focus on patients and be more efficient, like you said.
Yeah.
Yeah, let's switch gears a little bit. I know we've gotten into a little bit of kind of some of the more serious topics, but
Sure.
I know you're a pretty competitive baseball player. What's tougher, throwing a baseball for the first time or talking to a let's say a unhappy patient for the first time?
Oh. Um. Gosh, for the first time, I would definitely say the tougher thing would be, I would say, talking to a patient, like an unhappy one, especially. Learning to navigate that, especially, and diffuse and deflect appropriately without making them even more mad. Yeah, that's a tough one for sure. I'm a little bit of a funny mindset, if you will.
Yeah.
Coming from the baseball sports background, one of the things that I learned early on was when the coach stops yelling at you, that's when you should be concerned. So for me, I actually it's something I actually kind of look forward to residency. I almost halfway want to get yelled at by the physicians, or just to them to just tell me all the terrible things I've done. Like, how could you give them that? That's how you kill someone. It's like, oh, right, my bad.
Yeah.
But that's how you learn, and obviously that's like the point of the first year of residency is they give you the power to be a physician, but at the same time there's someone there to make sure you don't do anything bad or that you don't do something you really should do, and that's how you learn is by making mistakes. And to back to your point, especially with an angry person. It's just you have to go through those experiences to learn how you should handle it. Obviously, the very first time you do it, it's going to be like you're going to kind of be fumbling on yourself, and you're going to be a little panicked, like, oh gosh, this person's really mad. What do I need to say to them to like calm them down a little bit and just get out of this uncomfortable spot, if you will. And I think part of it too is it's kind of people like to say it, but know your audience. But at the same time, that can be tough in the moment. To kind of like how to deflect, because some people, I don't know. It's again, it's the more you do it, the more experience you have, the more ways you know to like how to approach or how to deflect or defend yourself against what may or may not be going on. But I would definitely say, yeah, an angry patient is tough. I could certainly, even if I had no idea how to throw a baseball, I could pick one up and just try to throw it in a general direction, and that would be great. I would if that was every encounter, I would excel.
Yeah, gotcha. Well, I think you kind of said the right thing there. I mean, in a sense, right? Like talking to a patient for the first time that's super angry, right? Very difficult.
Mhm.
Um, especially right, a lot of kind of interactions that you have with patients, right? It's kind of like repetitions, right? The
Yeah.
different kind of patients that you see over your career, you kind of go, oh yeah, I remember I dealt with something similar. And a lot of times it is just listening, of course, but of course, there's always levels of angry also, right? As you already
This is
know,
very
right?
this is very true, especially when the patient starts cussing you out or what have you. And you're just like,
Yep.
cool,
Yep.
cool.
And
That happened to me in the hospital. I
yeah.
don't know. I liked it. I thought it was fun. It's like walked out the room and read this like how'd it go? Patient cussed me out. It was great. I got to write that in the note and everything. Yeah. Oh God, it was. I don't know how far I should go with things, but yeah, I walked in. I said, "So, how are we doing today?" F you, and I went, "Great, great, good.
Yeah.
I'm glad, man.
Yeah.
I'm glad."
Yeah. Sometimes that is the case though, and sometimes you just kind of have to say that, a lot of times, as you already know, it had nothing to do with you, right? Like
Oh,
at all,
absolutely. You
right?
can't
And
take
so,
anything personally. You can't take anything personally. In this
yep.
game, especially. Oh my goodness. Yeah, it's you gotta let everything slide off your back because at the end of the day, you're trying to take care of them, regardless how they treat you. Regardless, I mean, obviously there are lines that that do get crossed, and that's a whole different thing altogether. But you have to understand where the patient's at. It's in context. Everything's always in context.
Yeah. Yeah, for sure. Everything's always in context. And like you said, can't really take anything personal, especially in medicine, either from a doctor patient relationship, from a resident attending, from medical school to residents, as you know, right? Everything is a learning thing. And kind of
No, for sure.
picking back what you said before is kind of the people that tend to mentor you and care for you, right? They tend to
No.
be the ones critiquing you, criticizing you, etc.
Yeah.
It's kind of when they don't, and they're just like, well,
That's when
that's
you
when
should
you're
be
like, oh,
concerned.
okay, I guess,
You're like,
yeah,
oh, they're giving up on you at that point. It's like, oh,
yep, 100%.
yeah.
So, are you still pretty active in sports in medical school? Would you say?
Oh, at the medical school, well, I mean, they do some intramural things. They have like softball. It's always tough for me to try to play softball. I'm the guy that I mean, I know how to hit the crap. I always joke because we played softball last year, and I joined one of the teams, and they said, "So you're gonna be good, right?" And I'm like, "Look, here's the deal. Either I'm gonna strike out or I'm gonna hit the ball over the fence. It's gonna be one or the other." It's not gonna. It's not. I can play the field. Put me in the outfield. That's what I played left field. Put me in the outfield. I'll catch all the balls. I'll throw people out if they try to run on me. I mean, if they're foolish enough. But when it comes to hitting, man, oh my God, they throw that beach ball up in the air, and I'm just waiting for it to come down. It's hard. It's hard with baseball. Every swing is kind of an all or nothing swing, unless you get fooled. Like, I mean, they throw like a changeup or something, and you're like on your front foot and throw your purse at it. It happens. But it's a funny thing trying to play softball. But we recently one of the fun things we do at Tech, we played the malpractice bowl. We played the law school in football, and I never was a football player, but I know how to catch a football. So, and I'm pretty quick. I surprise people with my quickness because I'm a bigger dude. But
Yeah,
I
you
was
are.
always pretty
Yeah, I would
fast.
never have known that you're quick. Let me tell you
Yeah,
that,
see,
girl.
I know. I always flew. I was actually the second fastest person at TCU. Nobody would know it. But yeah, they looked at you take one look at me like, nah, ain't no way. I just had a top. I have a fast top speed, so yeah, I'll get beat off the line, but I was quick. I was quick in the end. But it was too much fun, too much fun. We just to let everybody else know out there, law school, we beat them. We beat them pretty bad. It wasn't nice. Yeah, they always look for like loopholes and ways to win the arguments, and there was no loopholes out there for them to get around. We were just
Yeah, there's gonna be some law students that are gonna come on this podcast, and they're
good.
gonna call you out and be like, all right, we gotta start running. So
Good.
or
I
play some.
mean, good. I mean, hey man, whatever helps them out because they needed it.
Yeah, we also my year is when also went to Tech, and we played our first malpractice bowl. We brought it back. It actually got banned, I think, for a little bit because it got too competitive, and
Little trash talk out there. That's for
yeah, a
sure.
little trash talking, of course, how law school and medical school, as you can already assume. But we brought it back kind of my year.
Uh-huh.
We ended up beating them our year, but I heard kind of the year after me or 2 years after me, the law school won. So it's been pretty back and forth over the past, couple of years, 5, 6 years. So it's been fun, definitely to
Mhm.
bring that kind of rivalry back. So
Oh, for sure, for sure. Yeah, yeah. Our class, we're pretty athletic. We had a pretty raw team. I'm not gonna lie. The MS1s, they had three D1 football players, and it was not nice. It just
yeah,
wasn't nice.
that's a little unfair for sure, for sure. So talk to me about how you kind of have balance for studying for med school and kind of other parts of life that your social life or keeping up with family. I know you're close with your family, so
Oh, for sure. Yeah. I mean, I'm at my parents' house right now. Yeah. One of the biggest things, especially for work-life balance, what have you, is you just have to set priorities, and you have to set the amount of time you want to be able to spend with family, friends, what have you, and then you have to just also have the time that you're going to spend for studying and making sure you take the time to study, but more importantly, you take the time to be with your friends and your family, and make sure and keep that important. I mean, you'd be surprised how far a phone call can go just to talk to mom, talk to dad, talk to your brother, sister, anybody, anyone who's important in your life, just to give them a call up and just say, hey, how's it going? Even if it's just like 5 minutes out of your day, you would be surprised how much that helps not only you, but also will make their day a little, because they know we're in medical school, they know we're busy, they know we got all of these things we got to worry about, all these things going on. But it's so important, so important, especially in medical. Because I knew a lot of people in medical school that all they tried to do was focus on study, 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 and they forgot to live the rest of their life. And then as time went on, they finally realized, oh, maybe I should spend more time on myself rather than just studying my life away. But it all depends, person to person. Like obviously, some people need more time to study than others. Some people needed to sit down and just take 8 hours out of the day and just study, just straight study. And if that's you, that's what you have to do. You get your 8 hours, you plan it out, you know when you want to do it, and then you have to leave the rest of that time for you. Breaks, what have you, it's important. You have to do it. Me personally, I've just, in terms of time management, I've gotten way too good at just knowing how long something's going to take me, how long I need to spend on something, especially on my level of understanding. I was also a bit of a unique case in that. So I was a third-time reapplicant. I finally got into medicine my third time. I worked a job before coming into medicine, and so I was out of school for about 2.5 years before I started medicine. And for me, it was, I don't know if I'm going to say like rejuvenating, what have you, but having that time off of school and then coming back to school, it just, I don't know, it made everything feel so much easier. I have a semi-controversial opinion where I think medical school is infinitely easier than undergrad because, undergrad you got to juggle 6 different classes and be fully on top of all of them. Medical school, like I said earlier, in this one class, one very hard class, but only one class. So, I mean, they tell you everything you need to know. They lay it all out, and it's just, can you get it done, essentially. And especially during my first year, I was one of the few, the proud, if you will, one of 12. I went to all the lectures in the morning from 8 to 12. We got little 10-minute breaks, and we have a place. It's called the Office of Student Affairs, or OSA, as we like to call it. And I would always get coffee in between that for my little 10-minute break, walk back. They provide snacks, what have you. It's all free. They're all really nice there. We love them. And for me, I loved it. And I used to joke with my friend, this is Zach, same guy, that he also, same like me, third year reapplicant. He worked a job in Austin. I was in Fort Worth here. And we would joke, we're done at 12. And other people were like dying by 12. And it's
Yeah.
like, one of the bigger things you find out too is how kind of spoiled or whatnot you are with medicine, or with classes coming into medicine. Like some of the people were like, 8 is way too early to have anything. It's like, I remember our town hall meetings, and it's like, you do realize as a doctor you're going to work at 8 a.m. and go
Yeah.
until like 5 in some
Yeah.
cases. It's like, if
No.
you can't do that now, how do you expect to do that then? It's perspective, but I think
No,
that's
for
the thing
sure.
you kind of get as you get older.
Yeah, for sure. I would say that you make a great point about perspective, and I think that of course, I had Zach on this podcast, a week or 2 weeks ago, but kind of similar thing. I mean, I think you guys have going into medical school have a very different perspective. Did some things prior, right? Worked and kind of have a different perspective, and when you put that to medical school, it doesn't seem too bad, right? But of course, those traditional students. I was a traditional student, right? And when I was 22, how mature can I be at 22? Probably not super mature, right, to begin with. So definitely for sure, I can see that kind of when you guys are talking, it's you guys know exactly what you need to do, right? It's it's a little, in a sense, right? Everyone takes it serious, but you guys take it a little bit more serious, right? In a sense that it's you're a little bit more mature, right? You've done things before, and 100% that this is what you guys want to do for the rest of your life. I think some of us that do the traditional route, of course you feel like, oh, I want to be a doctor, right? But you don't know exactly how bad do you want to be a doctor yet, right? So
you get
definitely for
tested.
sure.
Yeah, for sure. I agree with that 100%.
Yeah, but yeah, that's impressive. I mean, I could not get to class. I'll let you know now. Like I watched every single lecture. I could not go in person. That was just like I could not do it.
For me, it was perfect because it was like I'm one of the types that it's like, if I don't go do it immediately, I'm not going to want to do it later on. So by going to those lectures in the morning, I did it. I saw it. I got it out of the way. And then for the rest of the day, it was like, if I wanted to review something, I did. But if not, at least I've already seen it. So when I come back to study and review it, I've seen it before. They'll come back.
Gotcha.
But yeah, it's to each their own. It doesn't work for everybody. You got to do what works for you. And lectures for some is just, the worst thing imaginable. For me, the way I always saw it was they can't test you on anything they don't tell you about or they don't try to teach you about, and the MBME is going to reflect what they try to teach you. So I would highly recommend thumbing through the slides that the professors give you before every test, because let's be honest, it's what they're going to put on it.
Sure,
And there might be
100%.
a couple extra ones they didn't necessarily quote unquote cover, but that you might catch with Anki or what have you. But
Sure.
it's gonna be like one or two.
Sure, sure. So what is your kind of your opinion on kind of, let's say, watching a lecture or hearing a lecture in person versus kind of, watching it online? Do you feel as though
Oh,
there's a big difference to seeing it in person or watching it online, or what's your perspective there?
personally, I don't really think there's a big difference between either or. It's really what works for you. I mean, obviously, when you watch a lecture, you can watch it at 1.5, 1.75, especially for like some of the slower speakers that take their time. If you're in person, you got 1x. That's it. You got to accept it for what it is. But it's just what works for you. For me personally, I just know that I'm not going to want to sit down and watch the lecture afterward if I don't go to it. But if I go to it, I'm already there. I'm going to watch it. I'm going to do it, and I won't have wasted time. Because for me, like I said, like especially our first year, we're done at 12. So every day I'm essentially done at 12, and then if I feel like doing more, it's more power to me. But for the most part, that's like the whole rest of the day that you have for yourself to do whatever it is you want to do or focus on whatever it is you want to focus on. So that's why I liked it a lot, just because if you wait to watch the lectures, technically, you could start at 12 and then you'd be done at 1. If you were doing it concurrent with the lecture, because they don't put the lecture up till after it's done. They usually put it out right at the end of it. So you would start the last lecture if you were on the ball at 12, you'd be done at 1. But for me, that's what worked. And again, everybody's different. Everybody how they learn, what have you. And it's more so the biggest thing, especially in medical school, is finding out what works for you. That's the biggest thing. I know I'm droning on about it, but you got to know. Not necessarily you have to know, but you have to just find. Find is the more
Yeah,
important word. Find what works for you. What's most effective. What helped you learn the best. And
for
for me,
sure.
that was just go to lectures, hear what they have to say, and then go from there. You go through notes, the lecture notes. You go through Anki. You go through Boards and Beyond. They do a great job. Sketchy's amazing. Love them. Pathoma. I would really do Pathoma. They're going to tell you everything you need to know in terms of all the things that can go wrong. Sketchy is just great at just teaching you all the micro, and then nowadays pharmaceuticals, they do a great job with that. But yeah,
Yeah,
just
for
find
sure.
what
I
works
think,
for you.
yeah, exactly. That's kind of the take home message. It feels though, you got to find out kind of what worked for you. And the key is finding out, right? I think when you start, I think everyone's at the same starting spot, and really, even whatever worked for you in college might not work for you in medical school because there's just so much
Exactly.
information. So you really kind of
Exactly.
have to figure it out kind of
Yeah.
as you go, and kind
Yeah.
of, it's kind of a moving target sometimes, but once you kind of locked it in, you become very efficient,
Yeah.
of course.
Oh, for sure. And you got to have your filter too when it comes to medicine, because they throw so much at you. You already know they can only ask for so much. So knowing the important topics and the major topics, and then maybe a little bit of the minutiae is about what you need. But
Sure.
you can't get bogged down in all the little things and then miss out on the big ones.
Gotcha. Yep, for sure. That's great advice. So tell me kind of a one huge misconception that you had about medical school once you started.
Ooh, man, that's a really good question. Wow. Hmm. Honestly, yeah, semi-controversial opinion here. But it's the only one that it's really come to mind right now. It's just I would say the overall difficulty. Obviously, I'm a different case than most people coming in from. I basically had a break, if you will. I worked as a scribe with COVID, and then COVID happened, and then I wasn't a scribe anymore because no more scribes allowed.
Yeah.
And then I worked some odd jobs. This is why I like AI, is because I had a job that involved AI, and then I actually had a job with a lawyer. I learned the law side of medicine, and then what have you. Then I was finally able to work as a scribe when they started lifting the restrictions off again on that. But again, just back to the main point. The overall difficulty, because like I said, I tell people all the time, I think undergrad was harder. Basically, again, it's a lot of information, but at the end of the day, you only have to focus on one class with one set of goals, with one material, like the set amount of material, and they can only ask you so much. Like on a test, most of our tests are 60 questions, and although one of my funnier things was I always like the 2 week tests. Those are my favorite because they can only teach you so much in 2 weeks. 3 weeks though, they can teach you a lot in 3 weeks. So those are always those tests. Those tests you got to buckle down and listen a little bit more on those ones because there's just a lot more information to know. But
Yeah.
yeah, they do a really good job here at Tech. One of the things I like the most is they front load everything. Like your
Yeah.
first week, a lot of information. They're throwing it all at you pretty much. But the second week is usually pretty light, unless it's a 3 week block, and you're still going to get some information second week. The third week it will be the light week, but when it's the 2 week system, you get it all in that first week. Second week, Monday and Tuesday, maybe you're learning some new stuff, but Wednesday and Thursday are just straight review, and so that way you're just set for Friday. And like I said, only so much they can teach you in 2 weeks, 3 weeks. Cool, they can drown you a little bit, but yeah, just overall the difficulty in general. Obviously, it's hard. There's a lot to it, but for me, I thought it was going to be. They're just going to be. I don't know. I don't know how to phrase it properly. Not more difficult because it is difficult, but it's just I thought I was going to be more overwhelmed. If that makes sense.
Sure. Yeah, I mean, I would say, Kyle, that definitely controversial hot take by Kyle here. For sure, I would say those that are listening, like the majority of people probably would say, yeah, med school way harder than undergrad. But I do have to say your situation is pretty unique. For one, right, a little bit more mature coming into medical school. For two, right, like I said, juggling all the athletics while doing undergrad. Actually, I have some friends that were D1 athletes also in college, and in a sense, they also said very similar things to you because, when you're juggling athletics and just barely finding time or energy to study in general, right, that's going to be very difficult. But of course, like you said, you're not juggling 6 classes. It's one very, very difficult course. But a lot of information, like you said, but yeah, definitely probably in the minority for sure, Kyle, but,
no, I agree.
yeah, but yeah, definitely a great perspective. So talk to me a little bit more heavy part of medicine, medical school or medicine in general, but anxiety, stress, and depression. How do you handle that mental strain in medical school? I know that for you, it might not be as much, but when you do deal with that, how are you handling it?
Oh, I got you. Yeah. So for me, again, I come from a sports background. Obviously, baseball especially. You put in a lot of high stress situations many a time, especially when you come to hit and have you. It can be a make or break at bat. You got to really be able to perform or at least do your job. That's one of the biggest things in baseball is quality at bats is what they always go for. That's what you wanted to see every time. And the quality at bat, if you want the criteria, is either an 8 pitch at bat or you move a runner, you get a hit, what have you. The main thing is you make the pitcher work or you help the team. That's a quality at bat. And so you always are trying to do that every single time, and you're expected to do that, especially in the college level. You're supposed to do that quite often. It's not like the pro level. Pro level is kind of nice. You're only expected to do well 3 times out of 10, which is amazing. College, sort of, but not as much because they expect it's still college. You should be able to still do like 5, 6 times out of 10, right? But in any event, I don't know. One of the things for me, for stress-wise, I've never really been the biggest type to stress. I would say mainly because I think that what stress comes from is either not necessarily having I want to say necessarily confidence, but almost like sort of like you're not confident you're going to be able to get to the point that you need to get to. And if you come into it with the mindset of knowing I'm going to figure this out, I'm going to be able to get this done and learn all this, everything I need to know in this time period and perform, it takes a lot of stress off you. In that sense, obviously, there is you want to be so confident that you fail because you think that, but at the same time, it's like if you put the time in and you know your stuff, I don't see why you shouldn't be confident that you're going to do well. And that's one of the things that happens in medicine a lot is people will spend all this time studying, spend all this time doing everything, and still be worried that they're not going to do well. When
Yeah.
the way again, I mean, that's what I think one of the things that helps you the most with sports is having a mentality or having a strong mentality of knowing I need to do this, I need to get A, B, C, D, E done. And if I do that, I'm going to, meet success. So for me personally, when it comes to stressing, I don't really stress really much at all because I know I'm going to get things done, and I know that with the plan I've set forth, I'm going to get to where I need to get. But one of the big things is not like work-life balance, as you mentioned before. But you gotta keep your hobbies. You gotta keep the things that make you happy, things that you like personally. This will help with depression, what have you, especially. For me, I love to go to the batting cage and hit off the tee. Like we have a D bat. Like D bat is a batting cage for baseball, softball, what have you. And I just will rent out a cage for 30 minutes and I will hit off a tee. And I just that's something I used to do in college all the time. It's funny. I put on like a country music playlist and I just hit off the tee. I don't think about anything. I just hit the baseball and I focus on the success on each individual swing. Like I want to see the ball go to a certain place in the back of the net every time. Like the goal is so the back of it makes like a little T, if you will. You want to hit that little spot right there with the backspin every time. That's like your goal, right down the middle. And all I try to do is that. And I just focus on that. I don't think about anything else. I just think a nice, smooth, clean swing and just do that. And I don't know, things like that can just help you reset, refocus on things. This is also a good time to call your family too and just see how everything's going.
Yeah.
Not necessarily that you're concerned or that you're worried or that there's something wrong with you, just checking in, seeing how things are. How are you doing? Yeah, having a human connection is important. Being able to talk to people, having family and friends too. I mean, a lot of people want to stress about having friends and stuff like that, but it's like if you're your own person and you are who you are and you're comfortable with who you are, you're gonna find friends. That's just gonna happen. People will naturally gravitate towards you, if you will.
Yeah, for sure. I mean, I
don't know.
Yeah.
Anyway, that's all I guess I got.
Yeah, no, for sure. I mean, those are all good things, Kyle. I think, I think stress and anxiety and depression, of course, it happens a lot in med school, as you already know, but I think it does come with, certain perspective of it too, and kind of how you, in a sense, right, in my mind, right, how you spin it too. So like you said, some of the most stressful times that I've had, if I think kind of like, okay, this is something that I can't control, right? I did my best. I worked hard at it, right? Now nothing to do it but to do it, right? And then that kind of releases a lot of stress, kind of like you said, right? It's kind of, you're already putting in the work, right? So, I mean, what's the point of, saying, oh man, I worked so hard, but I'm stressed about failing, right? But I mean, that's why you put in the work, right? So that's a great perspective. And of course, hobbies are great. I mean, even till this day, right? I mean, I maintain my hobbies. I work out every morning, have to do it, right? It's just kind of my stress relief. And of course, friends and family, huge important to me too. Like you said, I call them every morning, right? Me personally, just for a couple minutes, like you said, nothing wrong or anything, just saying hi. And of course, friends, right? I've hung out with you a couple times, right? And we've had some good times. And so, yeah, I mean, keeping that life outside of medicine helps reduce that stress too, of course.
No, for sure. And like you said, that's the biggest thing there is too. Control what you can control. And if you can't control it, best not worry about it.
Yeah.
Because there's nothing you can do about it. So you're just gonna make it worse.
Yep. All right. So what advice would you have for pre-med students looking into getting into medical school and are kind of struggling getting in?
Struggling to get in? Honestly, the biggest thing is you really just got to keep at it. I mean, if you know you want it, that's all. Like that's the biggest thing. If you know this is what you want to do, without a doubt, without question, then that's it. You put your head down and you go. I mean, obviously, sometimes you're going to get told no, and that's one of the that's one of the biggest things about life is you got to learn from your failures. You got to learn from when the times you're told no. Me personally, obviously, I've been told no from medicine a few times. One of the biggest no's I ever got was from baseball. Just because funny. My backup was kind of sort of medicine, but because I always wanted to play in professional baseball. And one of the biggest things for me was essentially getting told no in that department. It was like, I had a chance, but at the same time, it was just such a slim chance that it didn't make sense for me to go for it. And I had to kind of come to terms with that and just understand that, like, as much as I really want to go for this and, wanted to do it, it wasn't the smartest thing I could do for myself. But when it comes to medicine, I would say essentially, especially for people that, if you know you want to, and I know if you've been struggling, the biggest thing you can do is take class, like, especially if you're like me, like a third year or something like that. You have to keep relevant with medicine. You have to be able to do they always want to see like a college course or something like that. Like one of the biggest ones. I'm from Fort Worth. TCOM is one of the medical schools here in Fort Worth. DO school, but they have like basically classes for either postgrad, like undergrad, post undergrad classes, and kind of sort of some like undergrad classes. They want to see you stay semi-relevant to medicine. Obviously, the MCAT is huge, but at the same time, it's if you have good extracurriculars with like if you have a really unique interest, like a research thing you can talk about, that's going to go a long, long way. Like you'd be like, just having research is not that important, but having research that you can talk about, that you like, that you enjoy, that's going to go so far. Like people love that when you talk about that, especially something you care about. For me, I mean, we talked about this earlier in the podcast. AI, I kind of got lucky whenever I got let go basically from scribing in 2020. I found so there's this research project in Belgium. Antwerp, Belgium is where it was centered, and they were creating an AI. They named it Mona, and it screened diabetic patients for diabetic retinopathy at the same efficacy as ophthalmologists. That was the goal of the project. And what I did was they taught us how to mark images of eyes for microaneurysms and for hemorrhages. And so what we did was we would go through and we basically a data set of like 500,000 images of diabetic patient eyes. And I marked probably about 5,000 images of eyes. And you would just take little boxes and you would mark each individual thing for the AI to learn and scan. Today, that scanning system, Mona, is used in Europe as like a pre-screening thing, and it has a 90% efficacy. And it does a really great job. It's super cool.
Yeah.
But yeah, it's like things like that. Like if you have something interesting you can talk about with passion, like it goes so far. That's I guess that's the biggest thing I can say to advice. But
Yeah.
and just if it's your dream and it's what you want, don't quit. That's all there is to it.
Yeah. I think that's awesome advice, Kyle. I mean, one of the best traits kind of, I think, in medicine and just anything in life, if you want to kind of take it out to completion is, if you really want it, you got to keep going for it. And I think medicine is, some of the times it doesn't go your way. Even when you get to medical school, there's a lot of times where it doesn't go your way, whether it's, picking a certain specialty, not getting research, not scoring as high on tests as you want, right? All these things, right? They're a little bit of roadblocks, right? Or things that you have to improve on. And if you keep at it, right, you'll eventually get it, of course. But sometimes it is very difficult kind of hearing no. But I think that, you and Zach are probably, one of the strongest, mature minds of kind of your class. I've only met a couple of you guys, but, just because, you guys been told no, but you guys are thriving now. And so I think that's a huge, huge testament to, working hard and continuing to get through obstacles. So that's kudos to both of you guys. So, how about advice on people trying to, get into FMAT? How easy is it to get an FMAT? Kind of, there's only a couple programs out there, right, Kyle?
Yeah, sure. Well, when it comes to FMAT, really, especially coming into it to begin with, if you know you really want to do family medicine, or if that's what you're really interested in, I would suggest you go for it, because you can always drop out of FMAT or programs like that and go into just a regular class, even if at the end of the day you choose to go into family medicine. You do the normal 4-year route, but if it's something you're really considering or that you want to go into, I would encourage trying to get into it. Obviously, it's not like it's easy to get into by any means. I mean, you gotta have your stuff. You gotta be. Yeah, I mean, for us, one of the when it came to FMAT, at least for me, in order to get in, you had to be in the top 15% of the class to be eligible after the first semester. So they don't. Obviously, it's difficult to get into, especially if you didn't do it to begin with. So I would highly suggest, especially programs like that. I mean, if you have, unless you know for a fact you just don't want to do family medicine at all, then that's fine. Don't worry about it. Just apply as normal. But for family medicine, I mean, you check both. You just have another interview. Is what will happen when you have your interview times. You'll do the normal interview, then there'll be like an FMAT interview where you get to talk about, what you're passionate about family medicine for and why you want to do it, and what about family medicine appeals to you. And I think the biggest thing is do your homework, do your research. Biggest thing is, and I should say, I should have put this in my advice column, but shadow family medicine. Like, that's huge. Most schools want to see you shadow family medicine. They don't want to see you shadow a bunch of specialists because they're just going to assume, oh, so you just want to be a specialist, which it's not a bad thing, but it's just, if you do a lot of family medicine background, they'll go, oh, so you're open to that. That's the
Yeah.
thing, because most people at the end of the day are going to end up in like a family medicine, internal medicine sort of fellowship. So I would highly suggest that. If you have most of your hours in that and you have a few specialists to show interest, of course, like especially if that's what you want to do, that'll help for whenever you're going that route. To say, oh, I have this background, I've done this, I've seen this. But I would certainly have a large amount of time in family medicine, internal medicine, or just basically a general practitioner, what have you,
Yeah.
because that'll go a long way.
Yeah, no, for sure. I mean, I think medical schools are looking at that in totality more often than not because, because of the physician shortage as we talk about, right? And so
Mm-hmm.
kind of pigeonholing yourself into, I mean,
Mm-hmm.
I'm an ENT resident, right? But I mean, I can even tell you, right? It's not as significant if you're following me around as a pre-med and then applying to med school because it's just so
Yeah,
specific, right? But, if
exactly.
you're doing family med or, even, pediatricians or, any kind of
Pediatrics for sure.
primary care, it just
Mm-hmm.
shows that, you want all exposure, right?
Exactly.
You're looking to get into medicine in
Exactly.
general, right? So definitely for
Mm-hmm.
sure, there's strong words of advice there. But yeah, Kyle, so we're kind of running out of time here, but,
Mm-hmm.
I appreciate your time kind of on Beyond Scrubs. It was amazing having
Yeah.
you on this podcast.
Yeah.
I hope you had fun kind of just chatting
I
it up
did.
with me.
No, for sure. Thanks for having me on.
Yeah, for sure, man. Well, I hope we can do this again in a later time. Well, I appreciate your time and I hope that we do this again soon.
Sure, man. Yes,
All
sir.
right. I'll catch
Take
you
it
later, Kyle.
easy. See you, dude.